I am Theresa Malloy-Miller. I'm a member of Patients for Patient Safety Canada, which is a working group of the Canadian Patient Safety Institute. All of our members have experienced a patient safety incident, either directly or through a family member. My journey in patient safety began with our son, Dan. He was just a normal teenager, 17 years old, very bright, getting ready to attend university. And on a Saturday morning, he seemed a little bit tired and he was complaining about having to shovel the driveway. And 4 days later, he was gone. We learned after that he had myocarditis, which is a heart infection. And the stats say that if your child has myocarditis and you get your child to hospital, they should have an 80% chance of recovery. And we got Dan there twice in 3 days. Dan did not survive the care that he received. There were many miscommunications, many misdiagnoses. Blood tests were ignored or considered irrelevant. Team members didn't seem to be communicating with each other. No one seemed to be listening to Dan, and no one was listening to us. To lose Dan is devastating, and that's something we've learned to carry. And it is my motivation to pursue patient safety and ensure that other families don't live our story. Today is World Patient Safety Day, and sadly, many families around the world do live my family's story. In Canada, patient safety incidents are the third leading cause of death. That translates to 28,000 deaths per year. So every 15 minutes, a Canadian passes away because of a patient safety incident. And when I share that with people are shocked. Lots of the Canadian public doesn't understand these facts. We need to reduce patient harm. This is an epidemic of silence. We need to conquer this silence to reduce patient harm. If it looks wrong and feels wrong, and it is wrong, we need people to speak up. Patient safety incidents should be a source for learning and change. We need to know what happened, why it happened, and how that won't happen again. In the end, we are all patients. We all need to understand patient safety risks. We all need to hear stories from patients and families and healthcare providers. We need to understand what works and doesn't work. We all need to work towards safer care. We need to conquer the silence to reduce patient harm. We need to conquer the silence